Good morning, everyone, and welcome back in. Well, just like humans, dogs can have problems that happen to them, like back issues. And Dr. Noelle McKnight is the owner of Sound Animal Rehab and Fitness. Dr. Jerome Williams, Red Mountain Animal Clinic, our regular guest here on Good Day, Alabama. Good morning to both
Good morning.
of you.
Good
morning.
And who do we have here?
This is Max.
So Max, what happened with Max?
So Max had an intervertebral disc rupture in his spine.
So for the rest of us, what does that mean? What happened?
A disc in his back ruptured and put
So he
pressure
was
on his spinal
paralyzed, could
cord.
not walk.
So all of a sudden,
Could not walk.
he just could not walk.
Yes,
And
ma'am.
so he was brought in, them wondering what in the world was going on.
Correct.
And so do you immediately know this, or is that just something you have to x-rays and find
Well,
out?
clinical signs and diagnostics, x-rays, and he couldn't feel his feet, so his was pretty obvious.
Now, Dr. McKnight is a referral clinic, basically.
Mm-hmm.
So the general practitioner like me would have this kind of a problem, then I refer to a specialist like her.
Okay, so then you had to have surgery, and it's just like a human's back surgery, right?
Absolutely,
So talk about that.
So usually we refer them out to one of the specialty clinics that does that. They just go into the spinal canal and clean out the disc material and hope that they recover. Yeah.
So I want you to look. I want you to be able to see up here on the set that this is what this sweet baby had to use while it was in rehab. Talk about that.
So a lot of these guys, it takes them a while to feel their feet again if they're going to, but they can learn how to reflex walk, and supporting their balance and mobility while they learn to rewalk is something that we do.
And this is some video of what it looks like when they're on using them. Oh my gosh! So
Roxy.
So when we have seen this, because maybe sometimes you've seen this out in public or, on a movie or whatever, so it's not necessarily that it's permanent, it is a rehab situation.
Absolutely. Sometimes it's permanent, but most of the time we can get them to stimulate their reflexes and move.
And how do they respond? Obviously, these videos, they're responding very well, and so did this one, but mostly, how do they respond to this rehab?
Most of the patients do very well. We use a lot of high value treats for motivation. Our patients usually drag their owners in.
Really?
Yeah, they have a lot of fun.
Oh,
we make
that's
it fun
good.
for them.
You saw the device with the little red band on it? That's
Yeah.
a therapeutic laser.
Okay.
That's used as part of the therapeutic protocol.
To get them to move or to
It's
to
for
chase-
pain and inflammation. And then we use hydrotherapy, which is the underwater treadmill.
that baby.
The underwater treadmill is probably the bread and butter of rehabbing these neuro cases.
Now, is this, not all cases I would imagine have to be this drastic. There can be, rehabilitation happens for an injury.
Absolutely, and we also do a lot of geriatric fitness, which is, just about 100% of the dogs as they age get osteoarthritis. And if I could get every dog in the water at 8, 10, 12 years old, it really helps their mobility and their joint inflammation.
That's the same with humans, isn't
Yes,
it?
absolutely.
I mean, water rehabilitation really helps people who are having a back or leg issue, sciatic nerve pain issues.
Sure.
Those type of
Motion
things.
is lotion. Keep them moving. Keep them moving.
An analogy to her, what she does is similar to what a physical therapist on the human side would do.
Yes, sir.
Except she has got the medical degree as well.
Yeah, and you just can't ask them the questions and get the
No.
answers that you
No,
need,
you
right?
can't. You definitely got to use your eyes and your ears.
Yeah, so you really are investigating, aren't you?
I am.
Yeah.
A lot of the times, a lot of my patients come to me with a diagnosis. They've been referred to me by another specialist.
Okay.
There are some patients that come to me that are mysteries to their referring vets, and I try to help that referring vet tweeze out the problem.
Well, it's fascinating what you do, and it's just
Thank
good
you.
to know that you're here. So if anyone, if their dog, would you see someone whose dog, like you said, just is aging and you want to see what's possible?
Absolutely. Just ask your vet to send me a referral.
And also cats that don't show pain as well as dogs. She does a great job in rehabbing them as well.
All right. Just some good information for our babies that we love so much. All right, Dr. Noelle McKnight, Dr. Jerome Williams, thank you.
Okay?
Yes,
Always
thank
good
you,
to
All
be
Judy.
here.
three of you.
Yes.
All right, we'll take a break. We'll be right back.